Hello, everyone, and welcome to our Empowering Migrant show. As per the saying, medicine cure diseases, but only doctors can cure patients. So, today in our show, we have a renowned Dr. Raj with us. He's the head of Cleveland Family Practice based in Cleveland. So, Dr. Raj, welcome to our show.
Thank you, Abhishek.
It's great to have you, and it's a pleasure to have you at our show. So, today we're going to discuss a few questions around the medical related, health related questions that I have, which can be beneficial for our migrants community. So, the very first question that I have for you, Doctor, is what interests you in working here as a physician or GP?
Thank you to Bhartiya Samaj, and thank you for having me here as an empowering migrants show. I love to work as a GP because GP is a first primary contact for the healthcare system. Where here in Australia, people come to the GP for their major ailments, and it's a first point of contact. So from there, we as a GP try to address not only their issues from health issues, but different medical related problems. And from us, it just turns to go to the different health systems with the specialists and other hospital services.
So, what is the life like for GPs in Australia? Do you have to do long hours? Do you have to work really hard? How's the life?
As a GP, it's one of the respectable job. Like for example, when the patient comes and we treat them, if they get better, we feel very happy. That's one of the most rewarding job, and that's what we can do to help the society and the people and with their health.
Sure. Thank you, Doctor. So, as you know, many migrants they arrive in Australia with complex health needs. What should they know about the Australian health system? How can they come better prepared?
Okay, it's one of the very important question. People to understand when they come to Australia. Australia is not one of the cheapest countries to afford for the health. So when they are coming, it's individualized to each person. Like for example, if a student coming, or if coming as a visitor, if they're coming as an residents, temporary residents, all of those, everyone has got individual needs in their system. Like if they're a student, they don't have much of health problems, they can choose some basic health cover. So most of the universities they have overseas student cover, so which is included in their fees as well. But it depends upon what the cover is needed. For example, if the student has got some major health issues, then they might need a bit of a more extra cover apart from the basic cover. There's a standard cover, there's a premium cover, there's a gold cover. So that's what they have to decide, depends upon the health issues. So even for the visitor as well, we say they come for only 2 months, 3 months, doesn't matter. But if something happens wrong and if they don't have a basic cover, then they are in trouble, like not to going to the public system or health system anyway in Australia. It's like thousands of dollars to put in.
Sure.
So there is some renowned more the health insurance companies like Medibank, Bupa, HCF, but there is also where they can do a bit of a compare and analyze which one suits to their health issues. They can choose that one.
So in terms of that, so what are you mentioning about? That's more of a private insurance cover, or is it a Medicare, the government subsidized? So if it's the private, so what? Can you please tell us which visitors and visa holders from what countries are eligible for health services under the Medicare system?
So anyone coming permanent residents and citizens are only people who are covered by the Medicare.
Okay.
All right. Rest everyone else has to have a private health insurance. But one exceptional thing is there are 11 countries which they have a reciprocal health system where they can use Australian Medicare system. So they have an agreement with these 11 countries, so where they can use as a Medicare, but they also need to enroll it when they, as soon as they come from that country, they should come and enroll into the Medicare system. That's when they will get covered. And it lasts for only 1 year, and every year they have to renew it.
Sure.
As we get a Medicare card for the Australian citizen, they will have their reciprocal card as well, which they have to like liaise with Medicare and get it activated, and it works for 1 year.
Since the private health insurance companies encourage people to get a health cover through them, so what sort of health cover do you recommend is beneficial for the new settlers?
So the private health insurances encourages the private people to have some basic cover, and I think it's right to use it. It's because the Medicare do cover a lot of things, like generally going to the GPs, even to the hospital system and all that one, it does cover. But for example, if they have some major trauma or accident where they have to get operated, then this private health insurance kicks in, but they still it doesn't cover a whole part of it, but at least it will cover the hospital part of it. So it is very important to have at least a basic cover for a new settler, so that it balances off them from their pocket, and also have a bit of a private health insurance covered for themselves.
So, Doctor, how can migrants ensure that their family members, their spouses, their parents, they are applying for the right health cover? Are they eligible for any Medicare benefits or aged services benefits in Australia as a migrant?
People coming from overseas, like when their spouses are coming, their family is coming, their parents are coming, they should definitely have their private health insurance covers, or what we call it as overseas like travel insurance. They should have it. Why? Because unless you are a PR, permanent resident or citizen, their spouses are covered, their family is covered by the Medicare system, but not other people. Other people should have their private health insurance previously organized when they land in Australia. And definitely no aged care facilities are covered for any of the parents as well, or grandparents here. Only in exceptional is only 11 countries, which I was telling the Australian government had an agreement for the Medicare system. Those people are entitled only if they register themselves as soon as they come to Australia.
So how do you communicate the complicated medical information with patients, so especially to the new migrants?
Nowadays in Australia, there are a lot of people who are overseas graduates, and they can speak a lot of different languages as well. So, and also in Australian health system, we have an interpreter services out there, and it's free. They can choose, even people coming from any part of the world and any language, we can get the interpreter to come, and they can either do a phone interpreter or they can have a personal interpreter, which helps them to communicate their problems to the GP.
So my next question is regarding people, GPs from overseas who they are planning to migrate to Australia. So what are the upsides and downsides of immigrating to Australia as a GP that you see?
It's a very good opportunity if they come to Australia and work as a GP, and it's because it's a wonderful healthcare system, and there is a proper channel how to get into the system as well. But the downside is people who are coming from overseas, They have to do a lot of exams to clear the exams. It's one of the hardest part, and then there is a less number of like passing rate for the GPs. But not only for the GP, even for the specialist pathway, there are so many hurdles, so many exams to be cleared up. But once you pass those exams, you'll be wonders, like, you'll be happiest in the world kind of thing. So it's a very rewarding for it, and it's very satisfaction to work here in a proper health system.
Sure. So someone who is prepared to do all those exams again, it's a good opportunity, and it's...
Yes, it's always worthwhile. It's a hardship anyway to achieve the goals, but once you achieve the goals, they really have a good life here in Australia as a GP in a health system.
So Dr. Raj, what are the different pathways for the registration process of being a GP here in Australia?
Okay, there are few different pathways to come over to Australia. One is you need to do Australian exam test, which has got 3 components in there. One is written part like MCQ, then it's an oral part, then once we have, and also there is a OSCE test. If you finish those questions, then you get like a normal registration, and that gives you the key card to enter into the hospital system to work as a resident in any of the healthcare system kind of thing. But to do a specialization either as a GP or either as any other specialist, there is quite a number of exams you have to go through that. Each specialty has got different pathway and different set of exams, so you have to clear those exams. And other main thing is that because you are from overseas, you have to do 10 years of moratorium, which you have to do a service over the Australian rural places. The more you go the rural areas, the lesser the moratorium is there, so you can cover it up more quicker, and then you can go to the city places if you like to. Otherwise, it's very good to work anywhere in Australia.
So Dr. Raj, what is your final message to our viewers or audience? How has your journey been in Australia overall?
My journey was pretty difficult, but it was fruitful at the end. So I came here in Australia in 2008, and I have to do quite a few. In total, I would say around 15 exams I have done it. So I did my general registration, I did an diploma in emergency, diploma in pediatrics, and then I have done the general practitioner like fellowship through the RSCGP, fellowship through the ACRAM. So every module has got like nearly 3 to 4 exams, so which is very hard exams to pass through. But at the end, now today I'm very comfortable. I have my own practices as well. I've got few doctors working under me, which is great as well. So overall, the life working as a doctor here in Australia is quite very rewarding, and I really would encourage the youngsters to come over to Australia. It's one of the best place and safest place to live in Earth. So I would definitely do encourage them. It is a bit of a hard time to start, but it's always a fruitful ending there.
Thank you, Dr. Raj, for providing that valuable information at our Empowering Migrant show today. We hope this video has been informative for you. If you got any other comments, or if you want to know further about any other topics, please feel free to comment under this video. We will leave a little bit more details about Dr. Raj as well. Thanks for your time. Bye-bye.